In 2019, a team of researchers pulled together every major study on pet ownership and mortality they could find. Over 3.8 million people, tracked across multiple countries over several decades. They weren't looking for something cute, they were looking for a number. And the number they found was this: dog owners had a 24% lower risk of death from any cause, compared to people without dogs. For people who had already suffered a heart attack or stroke, owning a dog cut the risk of dying afterward by roughly a third. Let that sit for a second. Not, dogs make you happier. Not, pets are good for stress. A measurable, statistically significant drop in the risk of dying, tied to an animal sleeping at the foot of your bed. In the next few minutes, I'm going to show you exactly how a leash, a bowl, and a wagging tail turn into something that shows up on a survival curve, and why this might matter more after 60 than at any other point in your life. The study that surprised cardiologists. Let's start with where this actually comes from, because pets are good for you is the kind of soft claim that gets thrown around constantly, usually with nothing behind it. The 2019 analysis I mentioned was a systematic review and meta-analysis published in Circulation, Cardiovascular Quality and Outcomes, a journal of the American Heart Association. Researchers pooled data from multiple long-term studies spanning close to 4 million participants. This wasn't one small study out of one university. It was an aggregation of decades of independent research, all pointing in the same direction. The two headline numbers: dog ownership was associated with a 24% reduction in all-cause mortality, and among people with an existing history of cardiovascular disease, dog ownership was linked to a 31% reduction in death from cardiac causes specifically. For context, doctors get excited about medications that reduce cardiac mortality by 10 or 15%. A 31% reduction in a population that had already had a heart attack or stroke is the kind of number that would normally justify a very expensive prescription. Instead, in this case, it's associated with a leash and a bag of kibble. Now, here's where a careful researcher pumps the brakes, and you should too. This is observational data, not a randomized controlled trial. Nobody can ethically assign half of heart attack survivors a dog and the other half nothing, then wait to see who dies first. So there's a real possibility that healthier, more socially engaged, more mobile people are simply more likely to get a dog in the first place, meaning the dog isn't causing the better outcome, it's a marker of it. But, and this is the part that makes the story more interesting, not less, researchers have specifically dug into that concern, and the effect doesn't fully disappear even after adjusting for prior health status, income, and baseline mobility. Something about the actual presence of the animal appears to be doing real work. And when scientists went looking for what that something might be, they found it wasn't one mechanism. It was several, stacking on top of each other. There's one more study worth naming before moving on, because it addresses the causation question more directly than most. A 2017 Swedish cohort study, using National Health Registry data on over 3.4 million people, found that dog ownership was associated with a lower risk of cardiovascular death and death from all causes even after controlling for a wide range of socioeconomic and health factors recorded before the dog was acquired. Sweden's national registries make this kind of study possible in a way few other countries can match, because researchers can track health status well before someone becomes a dog owner, rather than relying on a single snapshot in time. That timing detail matters. It makes the healthier people just happen to get dogs explanation considerably less complete, even if it doesn't eliminate it entirely. The 4 ways a dog rewires your physiology mechanism. 1. Forced movement. This is the most obvious one, but the data behind it is more specific than you'd think. Multiple studies using accelerometers, actual movement tracking devices, not self-reported surveys, found that dog owners walk significantly more than non-dog owners, and critically, they walk more consistently across the week, including in bad weather, because the dog doesn't care that it's raining and still needs to go out. One UK study following adults over 65 found dog owners were, on average, getting roughly 20 more minutes of walking per day than non-owners. And that 20 minutes, repeated daily across years, is exactly the kind of low-intensity, high-consistency movement that cardiologists say matters most for long-term cardiovascular health, more than occasional intense exercise. Mechanism 2. A measurable drop in stress hormones. In laboratory settings, researchers have measured cortisol and blood pressure in people before and after interacting with a dog and found consistent, significant drops in both, often within minutes. One frequently cited study out of the University at Buffalo found that people performing a stressful mental task had lower blood pressure spikes when their dog was present in the room compared to when a spouse or friend was present instead. That's a striking detail. In that particular study, the dog outperformed the human as a stress buffer. Researchers link this to a concept called unconditional positive presence. A dog offers calm, attentive companionship without judgment, without the subtle social evaluation that even a loving spouse can unconsciously introduce into a stressful moment. Mechanism 3. An anchor against social isolation. We've talked before on this channel about how social isolation carries a mortality risk comparable to smoking. Dogs attack that problem from an unexpected angle. They turn a walk around the block into a series of small, repeated social contacts. Neighbors stop to ask a dog's name. Strangers at the dog park strike up conversations they'd never have otherwise. Researchers studying social capital in neighborhoods have specifically found that dog owners report more frequent casual social interactions and a stronger sense of community connection than non-owners living in the same area. It's not that the dog replaces human relationships, it's that the dog manufactures small, low-effort opportunities for them, which is exactly the kind of social contact that tends to dry up after retirement. Mechanism 4. A sense of required purpose. This one is subtler, and it overlaps with something about the risks of sudden retirement. A dog needs to be fed at a specific time. It needs to be walked, rain or shine. It needs you tomorrow morning, specifically you, in a way that doesn't negotiate or take a day off. Several studies on aging and caregiving have found that having a daily responsibility, something dependent on you, even a modest one, is associated with a stronger sense of purpose, and a stronger sense of purpose has itself been independently linked to lower mortality risk in older adults. A dog, in this sense, functions as a small, manageable daily reason to get out of bed on the mornings when there isn't an obvious one, movement that doesn't feel like exercise, stress reduction that happens automatically, manufactured social contact, a daily, non-negotiable sense of purpose. None of these 4 mechanisms is dramatic on its own. Stacked together every single day for years, they start to look like a real explanation for a 24% mortality difference. Why this matters more specifically after 60. Here's the detail that makes this especially relevant for anyone in their 60s, 70s, or beyond, rather than just a nice fact for dog lovers generally. Every one of those 4 mechanisms targets a specific risk that gets worse, not better, as people age. Physical activity naturally declines after retirement, when the built-in movement of commuting to work and moving through a workplace disappears. Chronic stress from health anxiety tends to increase, not decrease, as people start noticing more symptoms and attending more medical appointments. Social circles measurably shrink after retirement. Colleagues fall away, and studies on friendship networks show the average adult loses touch with a meaningful portion of their social contacts within the first several years after leaving the workforce. And a sense of daily purpose, which used to come built in from a job, has to be manufactured from scratch. A dog happens to sit at the exact intersection of all 4 of these age-specific risk factors at precisely the point in life when each of them tends to get worse. That's not a coincidence researchers have entirely explained. It may simply be that dog ownership was studied at a life stage where its benefits happen to be most visible, because the baseline risks it's counteracting are also at their highest. There's also a specific finding on cognitive health worth mentioning here. A 2020 study published in Scientific Reports, using data from over 214,000 people in Sweden, found that dog owners had significantly lower rates of cardiovascular death and death from other causes, and separate research on aging and pet ownership has linked regular interaction with animals to slower rates of cognitive decline in some populations, though this particular area still needs more rigorous long-term study before anyone can call it settled science. It's worth adding one more angle here that researchers studying widowhood have picked up on: the widowhood effect, where a surviving spouse, particularly men, faces a sharply elevated mortality risk in the year or two following a partner's death, appears to be measurably softened in people who have a dog at home during that period. The proposed explanation lines up with everything covered so far. A surviving spouse with a dog still has a forced daily routine, a reason to leave the house, and a living presence in an otherwise empty home, at exactly the moment those three things tend to collapse all at once. The part nobody mentions: this isn't free. It would be irresponsible to present this as an unqualified recommendation without naming the real trade-offs, because for a specific subset of older adults, dog ownership genuinely isn't the right call, and pretending otherwise would be dishonest. A dog is also a mobility demand, a financial cost, and a long-term commitment averaging 10 to 15 years depending on breed. For someone in their late 70s or 80s with significant mobility limitations, an untrained or high-energy dog can itself become a fall risk. Leash-related falls are a documented category of injury in older adults, and researchers studying fall risk specifically flag large, poorly trained dogs as a contributing factor worth taking seriously. There's also the question of what happens to the animal if the owner's health declines faster than expected, which is a real and often overlooked planning consideration, not a minor detail. None of this erases the underlying research. It just means the honest version of this video isn't "everyone over 60 should get a large puppy tomorrow." It's closer to "the mechanism is real, well-documented, and worth taking seriously. But the right animal, the right size, the right energy level, and a realistic plan for the years ahead all matter as much as the decision to get a pet in the first place." What to actually do with this? So what does this look like in practice? Not a vague "get a dog" suggestion, but specific, testable considerations. 1. Match the animal to your actual mobility, not your memory of your mobility. A high-energy breed that needs an hour of vigorous exercise daily is a mismatch for someone managing joint pain or balance issues. Lower-energy breeds or adult and senior rescue dogs, which shelters consistently report are harder to place, are frequently a better physiological match for older adults and come with the added benefit of already being house-trained and past the destructive puppy phase. 2. If a dog isn't realistic, look at the mechanism instead of the animal. Remember, the 4 mechanisms driving this effect were movement, stress reduction, social contact, and daily purpose. Volunteering at an animal shelter, dog sitting for family members, or joining a regular walking group can replicate pieces of the same effect without requiring full-time ownership. Several studies on volunteer dog walking programs at shelters have found measurable mood and activity benefits for the volunteers themselves, not just the animals. 3. Treat the daily walk as the actual intervention, not the dog itself. If you already have a dog, the research suggests the specific ingredient doing the work is the consistent, twice-daily movement, rain or shine, not simply the dog's presence in the house. A dog that gets walked around the block once a week isn't producing the same effect as one walked 20 minutes daily. 4. Use the social opening deliberately. The research on social capital found that dog owners have more casual interactions, but that effect depends on actually engaging with the people you encounter: the neighbor who stops to ask your dog's name, the regular at the dog park. That's not automatic. It requires actually taking the 2 extra minutes to have the conversation instead of walking past it. 5. Plan for the dog's future as seriously as you'd plan your own. Before bringing a dog into your life in your 60s or 70s, It's worth having an honest conversation with family about what happens to the animal if your health changes, the same way you'd think through any other long-term commitment. This isn't pessimism. It's exactly the kind of practical planning that protects both you and the animal. Closing. Nobody prescribes a dog the way they prescribe a statin. There's no line item on a standard physical for companion animal status, even though the mortality numbers behind it are, in some studies, larger than the numbers behind medications that get prescribed every single day. That gap is worth sitting with for a second. It's not that doctors don't believe the research. Most of them do. It's that a dog doesn't fit neatly into a 15-minute appointment, a prescription pad, or a billing code, so it rarely comes up, even when the data would justify the conversation. You can't fully separate correlation from causation in observational research like this, and it would be dishonest to pretend otherwise. But when a finding shows up consistently across multiple countries, multiple decades, and multiple independent research teams, and when the proposed mechanisms line up cleanly with things we already know affect mortality independently, like exercise, stress, isolation, and purpose, it stops being a coincidence worth dismissing and starts being a pattern worth acting on. 7.5 years, in an earlier video on this channel, was the number tied to how you think about aging. Here, the number is smaller but still real, and this time, instead of a belief you have to consciously rewire, it's something considerably more concrete. A leash, a bowl, and a walk you'd probably take anyway, if something out there needed you to. There's a certain symmetry between that earlier video and this one, worth naming before we close. Both findings point to the same underlying truth about aging that keeps showing up in this research, over and over, in different forms. The things that extend life are rarely exotic. They're not a new supplement or a procedure, only available in one clinic. They're ordinary, a belief you carry, a walk you take, a living creature that needs you tomorrow morning. The research doesn't make aging simple, and it doesn't erase genetics or bad luck, but it keeps pointing toward the same modest, unglamorous conclusion. Some of the most powerful tools for a longer life were never locked behind a prescription. They were sitting, this whole time, at the foot of the bed. If this changed how you think about getting older, subscribe, because next week, we're covering the exact reason some people's biological age runs years younger than their actual birth certificate, and how it's measured with a simple blood test almost nobody has heard of.